Welcome to Adapt NCLEX. If you can answer these 20 questions using just common sense, you are closer to passing your NCLEX or nursing school than you think. Let's prove it. 20 questions using common sense. By the end of this video, you're going to master how to answer questions using common sense. How do you answer question? Read it from the back. Who need to be seen first? Prioritization, patient prioritization. And nurse is caring for 4 clients with what? Chest tubes. They all have chest tube. It does not matter. You don't have to know the details about chest tube. What they're asking you, who need to be seen first? Then you ask yourself, look at each question, use some common sense, and try to eliminate the answers. A client with what? Intermittent bubbling in the water seal chamber. You know, you've heard it before that bubbling is bad, but they use the word intermittent. Well, and it's in the water seal chamber, something or a place where there's water. Of course, there should be some bubbling there. I don't know whether intermittent is good or not, but I know for sure it's not continuous. The second one, is a continuous bubbling, but where is it coming from? Suction chamber. In the suction, there is a bunch of pressure. It's going to cause things to bubble. Is that a right thing to think about? Or do you question that? Do you see that patient? Well, somebody have a collecting chamber. There is no bubbling. In the collecting chamber, I'm just receiving information from the patient. I'm not requiring any pressure. Therefore, there should be no bubbling. Is that okay? And then a client with what? Dry water seal chamber. Well, a water seal chamber means water seal chamber. That means there should be water in the water seal chamber. It's dry. You see what I've done? What do you think is the right answer? A water seal chamber that has intermittent bubbling. Well, there should be water there and there's bubbling, but it's intermittent. I would take intermittent over continuous. A suction chamber, well, look, there's a pressure coming. Whatever is going to go there is going to have some continuous bubbling. Collecting chamber is just collecting information. Therefore, if there's no bubbling, I'm not going to worry about it. But if you're a water seal chamber, there should be some water there. And therefore, I'm picking number 4. This is Adapt NCLEX. We're using common sense to approach these kind of questions. And if you can do that, every question, you're on your way passing your NCLEX or nursing school. Let's do all of them like that. This is a next generation Bowtie question. They always look busy. Don't worry. Let's read the question. We're going for the buzzword and we're going to use common sense. A 3-year-old, I've given you the age. Fine. What is the problem? Was seen in the emergency room for 3 days of diarrhea. I know at the back of my mind, the first thing I've read, the first sentence should give away the case. 3 days of diarrhea means I'm going to get dehydrated. Decrease oral intake. I'm going to get dehydrated. My mother report 1 wet diaper consistent with dehydration for the past 3 days. That means 3 days patient had 1 wet diaper and feel sleepy at all times. When you're dehydrated, you're going to feel sleepy. Examination, crying baby with no tears. If you have dehydration and you know having any tears when you're crying, something is wrong. Pale lips, consistent with dehydration. Your skin turgor is flat, consistent with dehydration. Capillary refill is longer, consistent with dehydration. What it is? Tachycardia, 165, dehydration. Blood pressure low, dehydration. As you can see, what condition the client is experiencing? Name 2 actions, name 2 parameters the nurse should monitor. In the Bowtie question, always make a diagnosis before you can figure out what to do with them. Don't pick an answer for action before you pick an answer for diagnosis and monitor. Therefore, let's look at the answers. I know this patient is dehydrated, but they give me different kind of dehydration. Common sense. Nurses, mild dehydration, moderate, and severe. Look at how much information I've given you about dehydration. If I want you to worry about mild dehydration, I'm going to give you just a few information. I've given you to the point that the patient is crying and there's no tears. It can be mild, it can be moderate. This is a severe form. And look at the pyloric stenosis. You know, pyloric stenosis, the key word is projectile vomiting. There is no projectile vomiting in the case given. Don't pick it because it's familiar to you. Therefore, this patient has severe dehydration. If you have severe dehydration, now, how are you going to monitor this patient? Of course, I'm going to give you some fluid. Of course, we're going to check your electrolyte. And then I have to see if your vitals is going to get better. And then if you're going to pee, because you have one wet diaper. So I got to know number of diapers is going to improve. Common sense, answering NCLEX questions. Don't make it difficult. Just try to master this kind of content. Number 3, this is the same thing. And then prepare to admit the client with what? There's a buzzword there. Crusted, number 1. Closed, number 2. Localized herpes zoster infection in the right flank. That means if this is the patient, there is a herpes zoster infection. This is localized, is closed, and is what? Crusted. What is which is the following is appropriate? Which of the following is appropriate? What do you think? Which of the following is appropriate? Airborne precaution, standard precaution, contact precaution, droplet precaution. Think about it. Think about it. Just use some common sense. Approach these kind of infectious control the same way. Look at it. Airborne, first of all, you have to know what is what. Herpes zoster, what kind of precaution do you provide? It's airborne and contact precaution. You have to know that, right? That one, you have to bring it to your content. Airborne and contact for herpes zoster. Airborne and contact. But there is certain information in the question, a crusted, a closed, and a localized information of the lesion. There's no way I'm going to think about airborne. Same thing. There's no way I'm going to think about contact if the thing is crusted and is closed and is localized. It's already gone through all the stages. Of course, you know it's not droplet. And therefore, this is a standard precaution. These are some of the ways you approach the question, and this is the concept associated with it that you can answer these questions. It is a standard precaution the Nursery Institute. Number 4, what is your score? Put down in the comment, hashtag, this is my score, and let me know what you think. Same thing, busy slide. It's a next generation NCLEX questions. Don't worry about it. Look at the way we're going to approach it. We're going to go for the buzzword and then use common sense to approach it. Which of the following should the nurse monitor after surgery? That means after the patient had surgery. That's all. That's the buzzword I'm using. A client underwent successful what? What kind of surgery? Coronary artery bypass graft. You have to bring a little bit of content and you say, hey, I know coronary artery bypass graft. What do? You go in and they open your chest and they fix your heart. They give you a new artery. They leave your old artery that is clogged and they bring a new one. Usually they go to your leg and they take a vessel from your leg and they use it to fix it. Or they use a different prosthetic graft. No matter what they do, there's a surgery in your chest. I don't know. It's a coronary on your heart, artery, a vessel. I'm bypassing something with the graft. That is it. Even if you don't know what is CABG is, coronary artery bypass graft, look at the answers. What are you going to monitor for this patient? Think about it. A chest tube? Of course. Every time you do surgery in somebody's chest, there is going to be a chest tube. The leg incision, I said they remove graft from your leg most of the time. Therefore, you're going to look for that. Now, what should be your content you should bring to answer the rest of the question? When I do surgery in your heart, I'm worried about bleeding. When you bleed around your heart, you get something we call tamponade. So the nurse should worry about tamponade. Therefore, what do you think are the signs and symptoms of tamponade? That's all. That's what this question is asking you for. What do you think? Big triad, and you know it. Tamponade, when there's blood around your heart, common sense tells you your heart cannot pump. That means there's something going to happen to you. The sound of the heart is going to change, muffled. And your pulse, what is going to happen? Your systolic and diastolic are going to get closer because your heart is not pumping. That is what we call narrow pulse pressure. If you take a deep breath, your blood pressure is going to drop because of the hypotension. That's what we call pulses paradoxical. Hey, if your heart is not pumping, you have a heart failure, semi-heart failure, right-sided heart failure, and that's what we call what? JVD. Of course, your heart is not pumping, your blood pressure is going to go down. That's hypotension. This is the way I want you to approach the questions. Test-taking strategy. That's what we're learning. Number 5, don't worry. You may see this cranial nerve and run away. You just have to know what are the signs and symptoms and how do you test it. Everything is in the question. Which cranial nerve the nurse is assessing? Okay, and the client was hit in the face. The question is asking about the face, but it's by his friend due to what? Minor misunderstanding. The nurse asked the client to do what? Swallow and make a speech. Swallow and make a speech. That's all you're testing for. The face does not matter. I worry about swallow and speech. If you master your cranial nerve, you know there's 2 nerves that involve speech and swallow, and that is 9 and 10. That's all. 5, you know, is trigeminal neuralgia that deal with the face. But what? Sensation of your face. We're not talking about sensation of your face. And then 11 is accessory muscles, talk about shoulder shrugging. Therefore, I'm left with this and that. But the question says swallow and speech. Speech and swallow is mostly number 10, vagus. And just a swallow is number 9. Therefore, if you need more, check Adapt and class. I have more videos on cranial nerve that can help you. But this is with planning to use common sense and trying to take away the questions. Don't worry. If you don't know, try to figure it out. Same thing. I make the questions harder. The more you stick around, you see it get harder and harder. I take you up and down, up and down. I want you to see how you can stand NCLEX when you are doing adaptive tests. This is a form of adaptive test and see how you can stand it. This is a hard one, but it's not. We're going to use common sense. Bring a little bit of your content. Which of the following is consistent or not consistent with the diagnosis? A nurse is caring for a client with rheumatoid arthritis. Every time they give you a question on rheumatoid arthritis, there's another one you compare with osteoarthritis. You know they're going to confuse you with the 2. Don't worry. Distinguish between them. The first thing you should know, rheumatoid arthritis is autoimmune disease, and then osteoarthritis is not autoimmune. Based on that, what do you think? Autoimmune disease, morning stiffness, of course, it's a joint involvement. When there is a joint problem, of course, morning sickness, morning stiffness is a common thing that you're going to see. Due to joint wear and tear, remember, it's autoimmune. It's an anti-what? Autoimmune disease. It has nothing to do with wear and tear. Wear and tear is pressure, injury to your joint, and that is osteoarthritis. It does not include that. Usually, both of them is involved. If you know one side, you know mostly people with osteoarthritis, they complain about my one knee, my left knee, my right knee, only one side. Therefore, the opposite is rheumatoid. Both hands will be involved. And since it's autoimmune, affecting usually small joint, osteoarthritis affects large joint. Of course, if the joint is involved, range of motion is going to be affected. And since I have stiffness, what do you think? I'm going to lay on this hard mattress so that I keep my joint in line. And autoimmune, I need an immunomodulator. Don't make the question difficult. Use some common sense. Apply it. We're using common sense to answer NCLEX questions. They may seem hard, but we can use that to answer it. And this is one example. Which level of healthcare has been provided? A 45-year-old client just had undergo colonoscopy for colorectal cancer. Is he a primary, secondary, tertiary, or quaternary? Then you ask yourself, why are you looking for colorectal cancer for using colonoscopy? What do you call it? When you're looking for something, it's what? I'm screening you. And if I'm screening you, it's not primary prevention. You are not doing it yourself to getting things to prevent infection. When you get vaccination, it's a primary. You went and get it to prevent future infection. That is primary prevention. When somebody is looking for the disease in you, even though you don't have it, it's screening. Therefore, colonoscopy has to be a secondary prevention. These are the way you should approach the question, and then you'll be able to figure out. Tertiary, the disease is already there, and we're treating it. Quaternary, when we're treating it, we should not cause too much harm to you. This is simple question to help you with preventive medicine. In one question, I've given you all the information to answer that question. Like I said, up and down. Another next generation question, but I know you know it. I'll just put a table around it. But look at the way we're going to approach it. And let's understand that this client, selected apply. A client with bipolar disorder was placed under involuntary admission. Test taking strategy. The question say patient was placed involuntary admission. The next understand involuntary admission is the key word. The bipolar is not the issue, it's involuntary. The next you understand that this client has been determined to be in danger to self or others. That's why we place it in the involuntary. Being determined to be unable to care for themselves. Is that consistent with involuntary admission? Requires seclusion. Is that consistent with that? A substance abuse issue. Is that consistent with involuntary admission? Patient has right for less restrictive environment and has the right to refuse treatment. Think about it, step back. Involuntary admission, that means you being admitted against your will. But there's a key and there's a concept. Like every question, I'm giving you the concept. You don't lose your right you don't lose your patient right, even though you be admitted involuntary. So privacy should be ensured and the right should be ensured. Based on that, okay, I'm going to admit you because you're going to cause harm to yourself or another person, involuntary. And because you cannot care for yourself, so that I need to provide some physical need for you. You should not place me in seclusion. Even if I have substance abuse, you have no right to admit me involuntarily. Since privacy should be ensured, client has right for less restrictive environment. And of course, based on that, they can refuse treatment. You see, it look hard, it's ethics, it's fundamentals of nursing. This video has everything that you need, both pharmacology, anything you can think of. But we can use common sense to go through the weeds and pass this NCLEX in nursing school. This is another example. Which of the following finding is most consistent? The buzzword is most consistent. And I want you to practice the way I approach question. Most consistent. I underline it. What is consistent? What issue? A client was admitted due to intimate. A client was admitted due to intimate partner violence. IPV. That's all. What do you think? The client provides a clear, consistent account of the injury. The client partner insists on staying in the room at all times. The client seeks help immediately after each episode of abuse. The client demonstrates high self-esteem and independence. What is your score? Pause this video, put down your answer, focus on intimate partner violence. Breaking down, ask yourself, intimate, that means you marry to the person, right? Partner, you are together. Violence, that means you being abused in the relationship. What would you do? Any person being abused would not provide a clear, consistent account. Common sense. The person who is abusing you will make sure they are around so that you can talk. The person being abused will not seek help right away. And the person being abused will not have high self-esteem. You see how common sense can answer this question. Based on that, we are picking number 2. Partner who attempt to control interaction, speak for the client, or remain constantly present to monitor what is said is the patient who is involved with what is the abuser of the intimate partner violence. Number 9. Let's go with number 10. I want you to know your score. Put down in the comment. Let me know what you think. But number 10 is a pharmacology question. Look at the way we're going to approach it. We're going to use buzzwords and test-taking strategy. Of course, common sense is the big. Which drug is contraindicated? That means I should not take it. A bunch of ways. A client with depression. I have depression, which was seen. A client with depression was seen in the clinic for follow-up. Okay. Client report new diet weight loss that include the following. Patient has depression, trying to lose weight. And what is the patient taking? Salami, pepperoni, smoked fish, and bacon. Where have you heard this before? Once again, common sense requires a little bit of context. We're using common sense to pick the answer and analyze the question. Have you seen salami, pepperoni, smoked fish, something associated with some medication you know? You know this is MAOIs. It's antidepressant, monoamine oxidase inhibitors. And then you say, okay, I don't know which one it is. If you don't know any antidepressant medication at all, I want you to know this: fluoxetine and sertraline. We're looking for MAOIs. These two are not MAOIs. Know them. Fluoxetine and sertraline. They are SSRIs. Therefore, you have 3 choices. You can pick all of them, or you can pick 1 or 2. It's fine. But I want you to know that this is one of them. This is one of them. This is one of them. Phenoxy, isocarbazide, tricyclamine are all MOIs. They have weird names. When you see them, memorize them. Take a picture with your mental eye so that when you see them anywhere, you know that this is it. Sometimes I call them the PEAT, or I call them the TIP. This is the acronym. If I see a medication and I can recognize it, phenoxine is a little bit tricky, but TIP is the way I can see them. And I remember they are all MOI if the question is a mental health medication. So phenoxine, isocarbazide, and tricyclamine are all contraindicated in this patient because they're taking something that has Tyramine in it. That will be a problem. So the client should avoid MOIs. So we have phenoxine, isocarbazide, and the T guy. This is the way to answer the question. Halfway, a nurse is caring for a client who had cast placed after leg fracture. Few hours later, client started complaining about severe pain despite analgesic every 1 hour. What will be the next priority action? Apply cold compression, apply warm compression, call the provider for more medication, and elevate the leg to the level of the heart. Think about it. Break down. If I place a cast and you're complaining is bad, common sense telling me, oh, we have a problem. But what is the issue? I've given you extra information. Even though a patient is complaining about pain, they're getting medication every hour. That tells you this is a bad problem, bad problem, bad problem. 3 bad problems. Therefore, what do? Try to save the patient. Do you want to remove the cast? Whatever you want to do. But that's not one of the answer choice. So what do you want to do? Cold compression, you temporize the thing. Warm compression, you temporize the thing. Calling the provider is good, but you're asking for more medication. That means you're not worrying about bad problem. Which one are you left with? Test-taking strategy. Common sense. Elevate the leg at the level of the heart. Number 4 is the right answer. You can see how I'm approaching this question. This compartment syndrome, patient need immediate therapy. Which side effects should the nurse monitor? A nurse is caring for a client receiving what? Ondansetron IV for nausea. Is a shorting QT interval, Torsades, respiratory depression, and hypertension. I will show you something. Look at it. Number 1, number 2. 3 and 4, they don't relate it to Ondansetron. Even though you see respiratory depression, mostly opiates and medication. If the NCLEX will give you a respiratory depression question, always is going to be an opiate. That's number 1. Some medication will slow you down, but not all of them. Benzos and opiate are number 1. Hypertension, okay, blood pressure goes up. I don't know. But if you use common sense, you can know shorting QT, that means your QT interval are short. Torsades is due to prolonged QT. One of them has to be the right answer. Prolonged QT and the shorting QT. One of them is saying something opposite. Therefore, the key answer choice is what? Ondansetron causes prolonged QT and lead to Torsades. This is the way you should approach the question. Number 12, down. 13, a nurse is reviewing pediatric client messages. Which call should be returned first? This is prioritization, patient prioritization. If you need more, check out after class of B-sharp videos. You can master prioritization 101. What do you think? I need to call first. A toddler mother report all household cleaners stored in the upper cabinet. 12-year-old not allowed in the front seat. 12-month-old riding forward-facing car seat. And a 9-year-old upset about a booster seat. Look at each answer question and use some common sense and said, a toddler, what is the problem? The mother said all household cleaners, which are bad, poison, is stored in the upper cabinet. The person will never reach it. It's good. 12-year-old not allowed in the front seat. Well, I don't know whether he's supposed to stay in the front seat or not. I don't know the age. Fine, I'm going to wait for it. But 12-month-old is saying the same thing. He's riding in forward-facing seat. Why would a 12-year-old not be allowed, but a 12-month-old is on the forward-facing car seat? He's looking forward. Now, something is wrong. These two don't agree. 9-year-old is worried that he's on 9-year-old is worried that he's on what? Booster seat. So fine, good luck with that. Therefore, I come back and say two patients. Number 2, 12-year-old, they don't allow the patient to sit in the front seat, but they can train the 12-year-old to be looking forward. I know number 3 is bad. They all have the same issue. A 12-month-old should not be having a forward facing. They should wait at least 2 years. A nurse is caring for a post-op client. The nurse failed to what? Monitor vital sign. When you fail to do something, that's what? Negligence. Despite orders for hourly check. Supposed to check on the patient hourly, but fails to do that. The client develops shock and died. Patient has shock and died. When there's negligence, and then there's complication associated with negligence, what do you think? It's just a negligence or malpractice or battery or false imprisonment? There's no evidence of false imprisonment. Use common sense. The nurse was not falsely imprisoning the patient. She did not even check on the patient. Number 4 is gone. She never touched the patient. It's battery, it's gone. Therefore, it cannot be negligence because she was negligent in the beginning and the patient dies. That's malpractice. If you need ethics video, check Adapting Test for more content like that. I have videos on this, how to distinguish between negligence and malpractice. Number 15. And this is evaluating for clients in the family medicine clinic, Prioritization 101. This, you have to write it down. I want you to take a paper so that when you see a question like that, you can master it. Which client need consent from the parent? You have to know which patient need consent regarding certain situation. This is fundamentals that it's very important to know. They are 15-year-old. They are female. One is requesting STD. One want to have rehab for drug abuse. Another person need contraception, and another patient need eye exams. Key content: STDs, drug abuse, contraception. Does not matter your age. You don't need permission based on the law. But if you're minor and you're going to have an eye exams, they need to know, get a permission from your parent. Number 4 is your right answer. 16. What is your score? Let me know. Put the comment down. I want to know how many people can get it. I said 20 questions. If you can answer these 20 questions, just common sense, you are on your way passing. Remember, sometimes the simplest answers is what? It's the right answer. Don't pick answer choice that you think is so hard. There's some pharmacology questions. You got to bring your content, something like that. Which prescription should the nurse anticipate? A nurse is caring for a client diagnosed with what? Bipolar disorder. You have to know medications for bipolar. Patient is having maniac behavior. Do you give them benzos, diazepam? Do you give them valproic acid? Do you give them bupropion? Do you give them methamphetamine? If you watch some video or you review bipolar, you know these people, they are hyper. Common sense tell you, you should not give them any medication that will give them the hyper situation. You know they are hyper. Therefore, don't make them more hyper. Don't give them any medication that will make them more hyper. What is that? Bupropion is an antidepressant. It's atypical, but will make bipolar patient hyper. That one, don't forget it. Methamphetamine is a stimulant, make that bipolar patient hyper. 1 and 2 are possible. Of course, we don't give benzos to bipolar patient. Therefore, in the maniac state, you can give them lithium or anti-epileptic. Valproic acid is an anti-epileptic, and that's what you give to this patient. So know that. Write it down. Lithium, anti-epileptics are used for maniac episode. They are mood stabilizers in bipolar patient. Very, very important. 17. 3 questions more. What do you think? Put the comment there. Which question was disturbing you? And let me know. A client was admitted for what? Presumed active TB, buzzword active TB, infectious control. I take you from everywhere, fundamental, pharmacology, everywhere to act as a mini test series for this. It's a test for you, 10, 20 questions to test your knowledge. Active TB, infectious control. What do you think is active TB? You know it's what? Airborne. Therefore, institute airborne precaution. That's all. Which action by the nurse is appropriate? Airborne precaution. Know the things, the PPE that you need for that. And that is N95. Wear surgical mask before collecting a sputum. I said N95. A surgical mask is not N95. It's wrong. Collect 3 early morning sputum. I don't know whether it's right, but I know TB, they go, you have to do some tests to confirm TB based on your knowledge. Well, whether it's 3 or 1 or 4, I don't know, but it sounds like a better answer. Common sense tell me I need to draw some caution. Place the client in negative pressure. You know your content that, oh, airborne need negative airway pressure. Of course, N95 mask is good. Keep the door closed at all times. Hey, it's airborne. We have to keep everything inside. That's why we have the patient in the negative air pressure. Therefore, you know that these are all right answers except number 1. What is your score? I know you get 18 out of 18. A client present to the neurology clinic reporting headache. 1, photophobia, nausea. That occur 2 to 3 times per month. So not frequent, just maybe 1 every other week. Physical and neurological exams is normal. So this headache is just a normal headache. But the buzzword is what? Photophobia, light flashes. Everybody know that if you have headache and you have light flashes and you have nausea associated with it, this is migraine. You have to know the 3 types of headache: tension, cluster, and migraine. And photophobia is key, distinguish between them to be what? Migraine. But look at the question. It said 2 to 3 times per month. Do you give them sumatriptan as needed at headache onset? As soon as your headache starts, then you take it? Or you let them take medication every day? Or you give them acetaminophen every 4 hours as needed? Carbamazepine daily for seizure. We know the patient has no seizure. Therefore, 4 is gone. Now let's look at it. Acetaminophen is not enough for what? Migraine. You need something stronger. Now you're left with the 2. Propranolol said take it every day. but the patient is having migraine 2 to 3 per month. If they're having everything more than 5 days in a week, yeah, they need propranolol. So Sumatriptan is the good medication for migraine as needed, but you take it what? On onset, not every day because it causes complication. Therefore, 1 is the right answer. 19. The client was admitted to the ICU with acute onset of what? Bilateral ascending paralysis. The buzzword is what? Bilateral ascending paralysis. Which of the following findings are consistent with the diagnosis? There's a buzzword there. And I want you to write it down. If you never heard it before, that's all you need to answer the question. Bilateral ascending paralysis. This is GBS, Guillain-Barré syndrome. What do you think? In Guillain-Barré syndrome, they have weakness from the leg to the knee, to the abdomen, to the upper extremities, then the airway, ascending paralysis. Content regarding that, you can find it on Adapt NCLEX. But what is number 1? Recent viral infection, check. Either viral and GI. Progressive weakness starting in the lower. The answer to a question say bilateral ascending paralysis. This is an ascending. If you have paralysis, you're going to have loss of deep tendon reflex. Test-taking strategy, common sense. If you have loss of reflexes, your muscle is not going to have increase. Tone is not going to increase. It's going to be flapping. Of course, your airway is going to get affected because it's a muscle. And you don't need vaccination for the family. This is the way to approach it. And that's the content I want you to know about Guillain-Barré syndrome. What do you think? Last question. This was a question somebody sent to me, and I want to share it with my group because it's a very important infectious control question. It's a test-taking strategy to test your knowledge. And nurse is observing a staff member caring for a client who has chickenpox. I told you chickenpox, you have what? Airborne and contact. Which of the following action by the staff member will require the nurse to what? Intervene. Place the client in a private room with a negative pressure airway. Place a box of disposable face shield outside the client's room. Place an alcohol-based hand sanitizer inside the client's room for hand hygiene. Place a surgical mask on the client during any transport outside the room. I don't know where the question came from, but it's a good question testing your knowledge. You know it's what? Airborne and contact regarding chickenpox. We're going to analyze each question using airborne and contact. Place the client in private room with negative airway pressure. This is consistent with what? Airborne. Place a box of disposable face shield outside the client's room. You presuming that face shield is what? Is it contact or airborne? Most of the time, a face shield is common in what? Droplet. You can use it in contact if you're touching the patient and if there's you're washing the wound and there's a risk of splash, but it's not enough for airborne and contact. Alcohol can be used for what? Hand sanitizer for what? Hand hygiene is okay. Place a surgical mask on the client when they leave their negative airway airflow pressure is acceptable. Therefore, number 2 is the right answer. This was a hard question, but it requires you to think critically. 20 question, have you proven to me that you're ready? If some of these questions trap you, remember, the most simplest answer is always the right answer. Use test-taking strategy and common sense, analyze this question, and you'll be on your way passing your NCLEX. If you need more, check Adapt NCLEX. If this video helped you, put the comment down and share it with your friend. Let me know which question you like and how Adapt NCLEX is doing. Take care of yourself and good luck.